Mr. President.
Senator from Tennessee.
Thank you, Mr. President. I want to congratulate the senator from Missouri for his comments. Sometimes I think Republican senators especially should begin and end every speech with an answer to the question, what would you do if you were in charge? And the senator from Missouri has said that very, very eloquently. And it's not the first time it's been said on this floor. He mentioned the law was passed 3.5 years ago. We counted it up one time. We mentioned 173 different times on this floor the Republican step-by-step proposal for a different approach to health care in this country. We said, don't expect Senator McConnell or any other Republican to come in here with a wheelbarrow with a 3,000-page Republican bill. We don't believe in that. We believe in a different direction, a different approach. We don't believe we're wise enough in Washington to write 3,000 pages of rules to govern every aspect of our healthcare system in America that takes 18 or 19% of the economy. We live in the iPhone age when we want to increase the personal freedom of Americans to live longer and better and safer and healthier, and we want people to be able to do these things for themselves. We want to increase choice and competition, and in that way lower costs. And if we lower costs, then more people can afford to buy insurance. That's the real way to expand healthcare insurance in America. Make it more affordable. Make it so people can afford it. So I'm beginning these short remarks with a salute to the senator from Missouri for talking about what we would do if we were in charge. And I'm going to end in that way as well. Well, for the last couple of months, we've heard countless stories from constituents who are losing the health plans they purchased on individual markets. According to America's health insurance plans, there are 19 million Americans in individual markets. The Obama administration knew that in 2010 when the rules it wrote for the health plans said that 47 to 60% of these policies couldn't be legally offered by Obamacare by 2014. Nevertheless, the president still said, if you like your health care, you can keep it. But now we know that wasn't true. According to news reports collected by my staff, at least 5 million Americans, including 82,000 Tennesseans, will lose their individual plan starting January 1st. That's an unwelcome Christmas present for those 82,000 Tennesseans. 16,000 Tennesseans are losing their Cover Tennessee plans. These are people who especially need help. 66,000 Tennesseans will lose their Blue Cross Blue Shield Tennessee coverage. I heard from a woman named Emily in Middle Tennessee. She's 39 years of age. She has lupus. She wrote, I can't keep my current plan because it doesn't meet the Obamacare standards. It's been a lifeline for me. With the discontinuation of Cover 10, I'm being forced to purchase a plan on the exchange. Emily writes, my insurance premiums alone will increase a staggering 410%. My out-of-pocket expense will increase by more than $6,000 a year. Please help me. This includes subsidies, she said. Please help me understand how this is affordable. Unfortunately, she's not the only one. Emily's not the only one experiencing rate shock. Millions of Americans are losing their insurance. They're being forced to buy new plans, many of them, with higher premiums, deductibles, and co-insurance. According to data from the Department of Health and Human Services, Tennesseans can expect to pay up to 3 times more on the exchanges being set up under Obamacare for the health insurance they now have. In 2013, a 27-year-old man in Memphis can buy a private insurance plan for as low as $41 a month. On the exchange, the lowest state average is $119 a month, a 190% increase. Today, a 27-year-old woman in Nashville can also buy a plan for as low as $58 a month. On the exchange, the lowest price plan in Nashville is $114 a month, a 97% increase. Even with that tax subsidy, if she made $25,000 a year, say, the plan would be $104 a month, almost twice what she could pay today if the $58 plan was all she felt she needed. Today, women in Nashville can choose from 30 insurance plans that cost less than the administration says insurance plans on the exchange will cost, even with the new tax subsidy. In Nashville, 105 insurance plans offered today will not be available in the exchange. According to Health Pocket Incorporated, a consumer-oriented health research firm, the average individual deductible for a bronze plan on the federally run exchange is $5,081 a year. This is 42% more than the average deductible of $3,500 for an individually purchased plan in 2013. And according to Deloitte, that is 348% more than $1,135 average deductible for an employer health plan in 2013. These are a lot of numbers, Mr. President, but Americans, millions of them, are getting familiar with these numbers because this has gone from being political to being very personal. According to Avalier Health, 90% of bronze plans require patients to pay 40% of the cost of their Tier 3 and 4 drugs out of their own pockets, compared with 29% of employer-sponsored plans that most Americans currently use. Most silver plans also require patients to pay 40%. For cancer patients and those with chronic illnesses, this kind of cost sharing could mean they will pay thousands of dollars out of pocket or go without the drugs they need to stay healthy. Americans had to wait until the exchanges opened on October 1 to find out just how much they're going to have to pay for insurance in 2014. With such dramatic hikes in premiums and out-of-pocket expenses, it's no wonder that Americans are outraged. And then, just before Thanksgiving, we learned that the Obama administration is delaying open enrollment for 2015 until after the midterm elections in November. The only American consumers this change will help are Democratic politicians who voted for Obamacare, because it will delay disclosure of some of the law's most insidious effects until after the election. Senators Barrasso, Enzi, and I introduced today the Premium Disclosure Act. We want to change the open enrollment date back to October and provide Americans notice of their premiums and cost-sharing requirements 30 days in advance so that they can plan for the future knowing their health care costs for the next year. This is a common-sense proposal that I hope my colleagues will support. As my colleague Senator Barrasso likes to say, what we know now about Obamacare is just the tip of the iceberg. Much of the media attention has focused on the disastrous rollout of the website and the 19 million Americans in the individual market. But just below the tip of the iceberg are 160 million Americans, nearly 10 times more than have individual policies, who the Congressional Budget Office says get their insurance through the job, employer insurance. Think about issues like restrictive grandfathered plan rules, limits on the number of hours employees can work and be considered part-time, the mandate that employers provide government-approved insurance or pay a fine, and the millions of dollars in new taxes on health plans. All these issues will have an impact on employer-sponsored health insurance in both the public and private sector. We're already seeing that. Employers such as SeaWorld and Trader Joe's and Home Depot and other companies have publicly said they're reducing worker hours or dropping part-time employee health benefits. The chief executive of Ruby Tuesday, a restaurant company, told me last year that to implement Obamacare would be equal to the profit his company earned during the whole year. And in case you think these are isolated examples, the National Association of Manufacturers says more than 3/4 of manufacturers cited rising health care and insurance costs as the most important business challenge. The U.S. Chamber also has a membership survey saying that 74% of businesses are reporting that the health care law makes it harder for their firm to hire new workers. This is at a time when jobs are supposed to be our principal concern in our country. Many of these businesses self-insure, meaning they design and pay directly for the health plans they offer to their employees. According to the Kaiser Family Foundation, more than 100 million Americans currently have an employer-sponsored health plan that's self-insured. Self-insured is a method of providing health insurance that's worked well. Since its inception in 1974, it needs to be preserved. And last month, Senators Rubio and Risch and McConnell and I introduced a bill to make sure the Obama administration doesn't change that, doesn't change the rule that allow companies to insure themselves against a medical claim that could bankrupt them. Any effort by the Obama administration to change the rule on companies that self-insure will break the president's promise to millions of Americans. It won't matter if they like their employers' health plans, they won't be able to keep them. And it's not just the private sector facing fiscal challenges because of Obamacare. Our nation's schools and colleges and universities are also being hit hard. No shortage of examples in my state, Tennessee, of local leaders dealing with Obamacare. Let's take the Franklin Special School District. It's begun limiting substitute teachers to working 4 days a week in order to avoid paying between $1 million to $4.5 million more per year in health care costs. Murray County Schools, south of Nashville, also limiting its substitute teachers to no more than 28 hours a week for the same reason. As one school board member told the local news, quote, "Students struggle enough having one substitute teacher, but then now we're going to have to possibly split the substitute time between 2 substitute teachers. It just makes it hard on the students to learn." Wilson County Board of Education wrote to tell me that Obamacare's reinsurance fee will cost the district an additional $165,000 this year alone. At least 9 other Tennessee school districts are reportedly limiting employee work hours or entire jobs, including Murray County, Clarksville, Rutherford County, Johnson City, Carter County, Washington County, Oneida Special School District, Scott County, Stewart County. Cumberland University in Lebanon has adopted a new policy to limit adjunct faculty to no more than 3 courses each term, meaning they won't be allowed to offer a course even if they're the most qualified instructor available. The impact of Obamacare on education is by no means limited to Tennessee. Investors Business Daily has identified well over 100 school districts and institutions of higher education nationwide that have made cuts or limited employee work hours because of Obamacare. That number is climbing daily, again suggesting this is just the tip of the iceberg. Remember, what we're hearing about today are individual policies. What we're going to hear about next year are employer policies being canceled, new costs, and there are 10 times as many Americans with employer policies as individual policies. Who pays the price for this? Our children. Cash-strapped schools simply don't have the money to absorb these costs, so they're forced to make difficult choices. For these reasons, broken promises, higher costs, fewer choices, Obamacare was a historic mistake. It expanded a health care delivery system that already cost too much and left Americans with fewer choices. Now, I said at the beginning of my remarks that I'd like to end in the same way, and I will do that with an answer to the question, what would we do if we were in charge? What if we elected a Republican Senate and even a Republican president in 2016? We would replace Obamacare, not by moving backward, but by moving in a different direction. Remember, Obamacare's real problem was it expanded a delivery system that already cost too much. What we would do instead is go step by step to introduce new ways to increase choices, to have more competition, and to lower costs, making Medicare solvent so seniors can depend on it, giving governors more flexibility with Medicaid so they can create programs with lower costs. Repeal the Obamacare wellness regulation. Senator from Missouri talked about that. Replace it with one that makes it easier, not harder, for employers to give employees lower health care costs if they live a healthy lifestyle. Let small businesses pool their resources and offer a low-cost insurance plan for their employees. The Congressional Budget Office says that Senator Enzi's bill would allow coverage for 750,000 more Americans at a lower cost if we did that. Allow families to purchase insurance across state lines. If there's a policy regulated by Kentucky, if it fits my needs and I want to buy it, why shouldn't I be able to do it if I can afford it? Expand health savings accounts. incentivize the growth of private health insurance exchanges. That's beginning to develop all across our country, giving more choices to employees. Make it easier for patients to compare prices and quality of doctors and medical services. Incentivize states to reward junk lawsuits. Those are the steps in the right direction that we'd like to go. When Irving Kristol died not long ago, James Q. Wilson wrote a tribute in the Wall Street Journal which struck me. He said that when they began their association as neoconservatives, they were mostly Democrats, he said, we were policy skeptics. He said that was mainly what our common view was. And by that, I think he must have meant that they did not believe that Washington could, through a comprehensive piece of legislation, fix our whole healthcare system. That what Washington should do, particularly in this iPhone age, is to go step by step in a direction that gives more personal freedom to consumers, to Americans, so they can live longer, live healthier, live safer, be happier. That's what we would like to do. That's how we would like to change Obamacare. And we would like to have that opportunity. So unfortunately, an unwelcome Christmas present this year for 82,000 Tennesseans is they're losing their individual policies. Even more unfortunately, an unhappy New Year is coming in which hundreds of thousands of Tennesseans will lose their employer policies, the policies that get through employers, because of Obamacare. We're ready to go in a different direction and create a way for Americans to have more choices, more competition, and insurance that they can purchase at a lower cost. I thank the President. I yield the floor.